Well, hi everyone. This is Kinkini from the USBC. I'm the Coalition Relations Director, and I love our peer sharing calls, and I'm so glad that you all could join us today. I'm joined by a couple of my teammates. We have two brand new staff at USBC who are just celebrating their 1 month anniversary. So Miriam Rodriguez is the new Coalition Relations Coordinator, and Adilene Robinson is our, I don't know your title, Adilene, we've done. So please go ahead and introduce yourselves. Yes, they are fantastic, and we are so glad to have them with us. So do you guys want to go do quick introductions?
Hello, my name is Adilene Robinson. It's a pleasure to be here for the first time in this peer sharing. I'm really excited to listen to you all. And I have a new title, so that's a membership engagement coordinator. I believe we are working on that. So hello to you all.
And Adilene will be working closely with you all because one of the things that has happened is that USBC membership bylaws that we've been talking about for a while were approved by our membership. So where we had just the national members being full-fledged US members, now every state, local, tribal, cultural coalition can become a USBC member. So Adilene and Miriam will be working very closely with you all to see what that membership in USBC means. So I'll turn it over to Miriam.
Yeah, hello everyone. My name is Miriam Rodriguez, and I'm the Coalition's Relations Coordinator. I really look forward to hearing you all share.
Thank you. And then Sandy is our program, our shepherd, our steery, who keeps us all on track, and we couldn't do it without you, Sandy. So thank you for being to ASPH and to be doing that. So would you go ahead and introduce yourself, Sandy?
Yeah, welcome everybody, and thank you, Kinkini, for those nice words. I don't have a whole lot to say.
You all know Sandy, everybody.
Yeah, they all know me, I think.
Yeah.
So, Diane, who was blurry sounding? Was it Kinkini or someone else, or is the sound sounding okay now? Kinkini, you were sounding blurry.
Okay. I see. Okay. Thank you. So if you all can see the attendee list, do you want to go down the list and introduce yourself? I see Diane first. Diane's, your line might be muted, Diane. Can you unmute? Okay, let's move on to Ifeanyi then. Hello, Ifeanyi.
Can you hear me now?
I can hear you, Diane. Go ahead.
Okay, hi. Sorry, I had to unmute myself two places. This is Diane Bath. I am the breastfeeding CoIIN team lead here from North Carolina. Glad to be on. I'm here in the Division of Public Health.
Great. And I wanted to say, we always do, like, what's one goal that you have for coming to this meeting? What do you hope to get out of it?
I guess just to hear about how other teams are doing and if there are updates from USBC that we should know about.
Great. Thank you, Diane. Ifeanyi?
Hi, good morning or afternoon for folks, depending on where you are. My name is Ifeanyi Wasiadu, and I am one of the CoIIN members from the state of California.
Welcome. Is Karen on?
Yes, hello, Kinkini. This is Karen Probert, and I'm the Executive Director of ASPHN. So I'm just listening in to hear the progress of the teams in this Children's Healthy Weight CoIIN. Thank you.
Welcome, Karen. Katie? Katie, your line might be muted. Do you want to unmute? Go ahead, Katie. I can see your, it popped up green. Okay. When we'll hear your voice when we can. Hope you can fix the audio. Kenya. Kenya's line. Your line might also be muted, Kenya.
It looks like she introduced herself in the chat.
Okay.
She just said Kenya Eddings with Arkansas Department of Health, it looks like.
Welcome, Kenya. Marcy?
Hey, can you hear me okay?
Yes.
All right. So I'm Marcy Brewer. I'm the breastfeeding team lead for Louisiana. Outside of that, I also am the breastfeeding program manager for the Department of Health and also provide some tiny bit of staff support to the State Breastfeeding Coalition too. And I think in terms of these meetings, it sounds like for me, and I'm sure for a lot of us, we're pulled in a lot of different directions. So touch bases like this, I think help to refocus me a bit and, obviously get some good ideas from best practices from other states and hear USBC updates. So yeah, thank you.
Okay. Thanks, Marcy. Nicole?
My name is Nicole Newman. I'm the state breastfeeding coordinator for the WIC program in Iowa. I work at the Department of Public Health, and I also am on the board for the Iowa State Breastfeeding Coalition. And work with that. And I would mirror exactly what Marcy just said. I look forward to hearing what others are doing and updates and best practice that's going on too, because where one state might struggle, we might get some ideas from them as well. Thank you.
Great. Thank you, Nicole. And welcome, Katie. I just saw the chat from Katie. Michaela?
Hi, this is Michaela Schlosser. Can you hear me okay? I'm using a headset. I'm not used to using it.
Yeah, we can hear you, Michaela.
Perfect. Yes, I'm Michaela Schlosser, and I am with our North Dakota CoIIN as the team lead, but I work as a maternal and child health nutritionist with the North Dakota Department of Health in our Title V program. And today I am just really looking forward to hearing from others on the work they're doing and just learning how it can help us as well in our state kind of think about next year.
Okay. Thank you, Michaela. Sean?
Hello, everybody. This is Sean Meyer, and I work for the State of Wisconsin Department of Health Services MCH program. I also sit on the executive board for the Wisconsin Breastfeeding Coalition, as well as a member of the Native Breastfeeding Coalition of Wisconsin. And the one goal that I have for today is, like many have already stated, just hearing the updates and perhaps learning about how teams have overcome any challenges that they have had along the way. Thank you.
Thanks, Sean. Anyone who hasn't had a chance to introduce themselves yet who joined us?
This is Jacqueline Bondi from the Nevada State WIC program. I'm the breastfeeding coordinator. So my goal for today is just to see what other states are doing and try to gather more ideas. And yeah.
Thank you for being here, Jacqueline. I hope you feel better soon.
Thanks. I know.
Ifeanyi, she is, I see your chat, you're chair of the California Breastfeeding Coalition and also faculty at the University of San Francisco. Ifeanyi was also our conference co-chair. So she wears many hats in the field. And in my resource list, Ifeanyi, I know that you all are doing a webinar or an initiative today at your at UCSF this evening, right? Is that?
Yes. Yes, we have a preterm birth initiative collaboratory this evening here at UCSF, which is focused on breastfeeding policies, global trends, conflict of interest, and consequences for marginalized communities. And really fortunate to have a number of colleagues and leaders in the field here to really discuss those different topics with our faculty, clinicians, staff, and students here at UCSF. So really excited about that. And for those who are in the Bay Area, please join us. And if you're not, there is remote access available via Zoom. So definitely send that out if anyone is interested.
I'm going to be
Thank
sending.
you, Kenny.
Yeah, sure. I'm going to be sending it out as soon as the meeting is over. So we have 2 good webinars today that would be relevant to our group here. So yeah, so is there anyone else who hasn't introduced themselves? No? Okay, so our agenda is pretty free-flowing. What we do usually is talk about, do updates that you have, and I'm hoping that today, if we did, we could do anything of those. Your project updates would be really great to hear about. Anything that you have to share that that resources you've built or anything that you need is a good place. This is a good place to do that. The CDC report card is out, so if you have any insights about how your state is doing or how you are, planning to use that data, that would be really good for us to hear. National Breastfeeding Month, if your state did anything, you have resources to share, that would be really, really good. And I'm hoping that if we can, we could, and I don't know, Sandy and Karen, you might already be working with the states on that, but Suzanne Haydu had a question where she said she'd love to hear from other states, or how are you kind of planning or working to introduce a nutrition component into your CoIIN projects if you've started thinking about it. So this is a lot. It's very free flowing. So any and all of the above you can talk about, like the CDC report card, your project, National Breastfeeding Month, and anyone who wants to go first, we could do that. And then we'll end with a few USBC updates. So we have some resources for you, some things that are in the horizon. So I'll end with the USBC updates, but we'll do some peer sharing first.
Well, this is Diane Beth. I'm happy to go first.
Go for it, Diane. Thank you.
So our CoIIN this year, for some that have been on these calls before, has been focused on father partner support of breastfeeding. And basically we're in the phase of our project where we are testing an intervention with a home visiting program called Healthy Beginnings, and where they also do group sessions for pregnant moms and moms that have already had babies. So we did a fairly large literature search to try and find materials that were available back in the fall and spring, focused on dads and or partners. And what we ended up finding was Breast for Success, which is a program and an intervention that was run out of University Hospitals in Cleveland, Ohio, targeting mostly African American mothers, but I believe they also used community health workers. So we eventually got local partners because we had to, for our PDSA cycle, we had to sort of get it down eventually to a local level to test. And our local partners liked the Breast for Success materials better than they seemed to like the USDA materials for fathers that were available at the time. And so we're again in the testing phase. We did because we did identify that our partners said that they mostly had dads/men as the partners, but they did have one or two same-sex couple partners. So we adapted the Breast for Success materials to basically just make the wording in one of the materials of theirs just a little more inclusive of the words partners, because again, in our research, we just didn't find anything really out there that specifically said partners. So we're again in the test phase. So in August and into September, our local partners in one county will be testing the materials in 2 breastfeeding group sessions, and then using some of the same materials for home visiting, discussion aids, if you will. And we developed some pre and post questions that for the classes that will be administered, and then we hope that, to be able to look at that data and then obviously have a discussion with our local partners about what they thought about the materials, what they plan to do differently, to sort of give us a better sense as we think about more statewide implementation. What seemed to at least work in this one particular PDSA cycle and one particular community. So I'd say that that's taken us a lot longer to get to this point than we had expected. But I think the team is committed to seeing it through. And I guess I would just say, in the meantime, the other thing I would say is that in response to Aspen's request for a summary statement to be sent by the end of August, for me as the project lead, who sometimes, and I'm sure others of you feel like this, you have these teams with very, very, very busy people who often can't self-admittedly spend as much time on this CoIIN as they would like. And so I think, and while we keep very detailed minutes that help to sort of, me especially, and our co-lead now, sort of go, okay, now what do we do and what do we have to do for the next meeting, just to keep things moving along, because again, we've got a lot of things going on besides just the focus within the CoIIN. But I will say that for me, I felt it was important to try and put together what I'm calling a project description that is sort of a process, focus, description of our intervention, our successes, our challenges, our lessons learned, our outcomes when they are available, and then a summary. It's taken me longer. I think everything has taken me longer. I guess I'm a slow writer, but for me, at least, it has helped to try to tell the story of this project, and pull together pieces that would be hard to pull together from just looking at meeting notes. So for me, if nothing else, I'm viewing this as like, if I were going to submit this as a research project, not that heavy core, but just trying to put together thoughts and go from one point to another. So I'd say that that's been helpful, and from that, I'll be pulling together what I'm going to be sending to Aspen, which at this point will be much more abbreviated than this.
Thank you. And you're addressing a big gap. We've been trying to find resources on partners, not just inclusive language, but even fathers as well as partners or chest feeding and others. And it's really, there is not enough information. So it's good that you're creating some of that. We'd love to see um, when you're ready to share.
Sure, of course.
Thank you, Diane.
This is Nicole Newman. I can go next. We have encountered some barriers with one of our main goals that I had hoped to accomplish much earlier on with updating a WIC breast pump policy, because we identified a lot of gaps between what's going on conversationally between Medicaid and maternal health and WIC, and where people should go for pumps, because Medicaid doesn't cover pumps in our state, although it's come to the table that they actually kind of do. There's DME programs working with our MCOs that are getting it covered as somewhat of a value-added incentive. So there's just a lot of confusion going on in our state. So to that reason, I haven't yet finalized that policy, because there's a lot of unknowns and a lot of for whatever reason, a lot of sharing that's not taken place on Medicaid's end. So I'm hoping very optimistically to have that done at least by the end of September, because we want to get that started. We planned to pilot it in a local WIC agency, or in one area where we can make sure that maternal health and maternal health and Medicaid, everybody can be giving the same message to people on what WIC is providing for pumps. On a good note, we've kind of expanded what we might be able to help with WIC. The idea is if Medicaid can't cover as many, we're hoping to be able to cover more than just those that are away from their baby or working and those kinds of things, to cover more situations than what we've currently been doing. So that is positive anyway. I will say about the CDC report card, I was excited to see that Iowa improved on their duration rates pretty significantly. Our initiation went up a percentage, and actually the duration rates is what saw the biggest jump. So I was very excited to see that, because I know there's been tons of conversations going on with all of the programs that support breastfeeding across the state. So that was really exciting to see that happen, because it's a number you can look at to kind of put data to all the hard work that everybody does. Additionally, with some of our CoIIN projects, I know we are funding CLC training for some minority staff, which we identified areas where we thought that might be the most helpful. And we are having the hardest time find anybody of different ethnicities. We were looking for African American, but kind of opened it up to anybody. And we are having a hard time finding anybody able or interested. We had some takers at first, and then schedules became a problem. So we're hoping that they're able to do that training here yet this fall. So we have the funding for it, and that's been all set to go. But yeah, just getting them to do it has been a main barrier. I don't know if anybody else has encountered things like that when trying to get their group together, if they have a similar type of initiative.
Where are you promoting? Yeah, where through WIC only, or
no, WIC, maternal health. So we've got I'm the state WIC breastfeeding coordinator, so I went out to all the WIC agency. We have the maternal health, of course, on our team, so all of their agencies were notified, and we've even sent it out to several different hospitals and clinics and those kinds of things, and still struggled to find volunteers. So it seems like, even when the resources are available, we were going to cover the travel and that kind of stuff, or lodging and whatnot, and we're having a hard time recruiting still, unfortunately.
This is Kenya in Arkansas.
Mm-hmm.
One of the groups that I work with, Healthy Active Arkansas, one of the priorities is breastfeeding, and we just got a grant from the Blue and You Foundation to work on breastfeeding efforts. And part of the project that we're doing is not. I'm just speaking we generally, but the team is doing is hosting a CLC training for those who work in birthing hospitals around the state, and the grant is covering the travel and the cost of the test and everything.
Sure.
And so it's going to be a week-long training, and I think that it was open to like 75 participants, and I think that we have like 65 participants right now. I'm not sure what the makeup is as far as race or ethnicity, but I can definitely reach out to the team lead and ask if we've captured that information, and if so, how did we go about, did we do some specific targeting or anything like that? I'm happy to ask that question and report back.
That would be great. I mean, so what we have done by now is identified that we would, there are some that have committed, and we're hoping it doesn't fall through again because of that, but we hope to continue funding more because we think that education is crucial for them to have, and especially because we wrote it into our CoIIN with the difference in rates of breastfeeding between, especially in Iowa, African American population and other ethnicities, but mostly that. So that's why we were trying to identify that specifically. But yeah, it was much more of a challenge than I would have ever anticipated.
Hi, this is Ethanwa from the California CoIIN. I think one of the suggestions I would share is that I think oftentimes we create these goals or activities or objectives, and we don't necessarily include the individuals or communities that we are hoping will participate. And so it may not necessarily be a priority, right? And so it'd be important to maybe go back to some of those individuals that you've already reached out to see if it is. And I completely understand it's already written in your plan, and this is something that you all said you were going to do. But I would caution us sometimes in terms of it's really important to go into those communities and really make sure that what we're doing is community-centered and needed and is of interest, because that can also play a role in regard to interest and participation.
Sure.
Absolutely.
I will say, too, that I noticed, I suppose just as a general observation, that the number of minority breastfeeding support people we have in the state of Iowa is incredibly low because we're a mostly Caucasian state. We don't have a ton of diversity anyway, but unfortunately a lot of the support people that are out there might be people that are Caucasian, and that's where we might have had a lot more interest or people jumping at the opportunity. We play that fine line of we do have peer counselors that are interested, and at this time, because of that being our funding that we want to disperse, I believe we're going to be funding them, and it's separate than peer counseling funding, so it seems like it'll work out.
Yeah, a lot of partnerships. I work in Alameda County in the San Francisco, Northern California region, and we are getting WIC is developing a lot of partnerships with community-based organizations, faith organizations that we haven't, and sometimes we just need to go into places where folks live and be able to or have allies and partners that are embedded and in intrinsic parts of the community, because then there's that bi-directional where we can it's a great way to get to know what the community priorities are as well, and how we can match and align and get something that's along our shared goals. I think moving forward for even the nutrition part, it's so important, so important for us to be really intentional about working with our local communities or whatever the scope is as we develop our plans.
Agreed. Thank you.
Thank you, Nicole. Diane, I meant to ask you, are your materials available in any other language other than English? North Carolina? Home visiting stuff.
Oh, well, we're still right now, because the Breast for Success materials were only targeting African American women.
Okay.
No.
Okay.
So, I mean, who knows? I'm sure at some point, if we get to that point, if we found other materials that were found to be culturally appropriate for, Hispanics, I'm sure we would move in that direction.
Okay.
But yeah.
That's your target population is African Americans. Thank you, Diane. I wanted to clarify that because we get a lot of questions about resource sharing, and a big part of USBC staff is to connect the dots, and we'll say, oh, so and so,
Right.
this state has that, and you need something, call up, and we connect. So we make copious notes of what you all are doing as well, because that helps us
Sure.
identify where things are happening and where there might be gaps as well. So thank you.
Yeah. I guess let me just add, I mean, I say our focus because of the county that we're working with, and the project is mostly African American, but I know that our local partners there have said that they have some Hispanic moms, but that they have also acknowledged that those moms themselves speak and read English, although their partners do not. So for the moment, we haven't had to, if you will, worry about having materials in other language yet.
Thank you.
This is Jackie. I guess I'll go ahead and go next. Can you guys all hear me?
Yes, Jackie.
Okay. So I'm still in the process of trying to finalize my team. So our focus is partner support, and so I'm trying to pull in some of our WIC peer counselors that are women of color that are cornerstones in their community to see if they can participate and help us with our goal of just promoting partner support in our WIC clinics. So that's where I'm at.
Right.
Just
Thank
nothing too big to report.
That's thank you for that.
This is Kenya from Arkansas, and on our project, we have what we're doing is identifying work sites and ECEs around the state to go in and do some work site training regarding lactation accommodation laws and the laws that are currently on the books for Arkansas and federal laws. With the ECEs, what we're doing is targeting them based on neighborhood, lower SES communities, et cetera, and then also trying to make sure that they're close to the work sites where mom can come and pump and or breastfeeding throughout the day to make that space available at the workplace and the daycare. We've identified 3 daycares right now that we're beginning work with. And one of the things that we're doing first is to ask the ECE to complete the breastfeeding questions that are found on the CDC scorecard. Is kind of like a pretest. And then we'll go in and conduct a worksite training using the business case for breastfeeding and kind of modifying that to kind of fit, what our population is and what the needs are. And then afterwards, we help them to identify spaces and or rooms that might be best to set up a lactation accommodation space for mom. And then once we help them get established, then we'll go in afterwards and then do kind of a post-test asking them to complete the CDC breastfeeding related questions again. So like I said, we've identified 3 to get started with. We were hoping to implement at least 1 or 2 before the end of August for breastfeeding month, but we were unable to. But still, I think that we'll be able to get started with them at the 1st of September. And so we have a couple others in the pipeline. So that's where we are right now.
Thanks, Kenya. And you had mentioned that, is it food service that you're doing it in restaurants or just generally low wage work sites?
Just, yeah, low wage work sites and ECEs.
So have you all noticed that the site has changed and that it's undergoing revisions? Does anybody? This is
Yes.
the Office of Women's Health. So they are revising, and do people know any more about what's going on, and if we'll have our bilingual material available when?
I don't know.
Yeah. So some of it is, as you can see, if you've used this, is the supporting nursing mothers at work, the employer solutions, the big platform that used to be there. So the OWH is doing some, as they said, reworking the site to make it more mobile friendly. So we hope that a lot of the rich stuff is maintained or comes back and is not lost in the next iteration.
Well, I'm happy to say that this is Kenya again from Arkansas, on the those newest breastfeeding guides, your guide to breastfeeding, we actually hosted a press conference at the Bill and Clinton National Airport last Friday. They just opened a mother's room or breastfeeding room specifically for ticketed passengers, and it was a big deal, and there was a lot of press about it. And so we were able to get some of those breastfeeding guides that you see there on the screen and stock those in the breastfeeding room. So for moms who come in and out, they'll be able to see that latest guide there.
Thank you, Kenya. That's good to hear from Arkansas. I know we had spoken to Ursula Singleton from the Office of Women's Health, and as of now, they don't have any plans to be translating this into any other language. There was OWH had a stakeholder group that gave feedback on the guide, and one of the things we wanted to know was if they were, there are states, I think it was North Carolina, that said that they needed Arabic, Chinese for sure, and Spanish, but as of now, it's going to be available only in English. So we need to keep advocating for those culturally and linguistically congruent materials as much as we can. One of the things that they said also is that it's helpful for folks who use the resources to write and let them know. So at some point in time in the near future, USBC might be mobilizing and galvanizing for that too, so that we keep that feedback loop going. Questions? Anyone else? I see Kelly's here. Kelly Stater. All right. Anyone else would like to share?
Hi, this is Sean Meyer from Wisconsin. I'm not sure, I know Kelly's on the call, but I'm not sure if she has access to a mic, but she is listening in. And I'll give a little update from Wisconsin. We started out our ASPHN work by forming a worksite committee through our Wisconsin Breastfeeding Coalition so that we could have local and tribal representation on our larger group. So we have a core team, and then we have our larger worksite committee that has been helping to move efforts forward with this CoIIN project. We started out by doing several PDSA cycles, looking at surveying to see what the needs were for local businesses throughout Wisconsin and how they would feel about a statewide recognition program. And through that, we realized that there definitely was a need for funding towards creating lactation spaces, modifying sites at work site places to create lactation spaces, and then also linking lactation spaces with a policy. And so we created a mini grant application process and funded 10 mini grant applications where we launched that in the beginning of August for Breastfeeding Month, and so we're closing our application process tomorrow. And so we're excited to see what we're getting back with that. And we also included a health equity lens approach with our mini grant application so that we felt like the reach was to communities that have more disparities and trying to increase initiation and duration rates for mothers and breastfeeding parents that are returning to work and school. So we're excited about that launch and getting in many applications, so we'll see how that goes. And so far, most of them, just with a preliminary review, do have that health equity lens and looking at tribal sites and other like the YMCA, YWCA sites that are located in areas that would have that potential reach.
That's wonderful.
Yeah, we're very excited about it. And we are also bringing worksite efforts to our Wisconsin Breastfeeding Coalition annual summit. We are bringing updates with the CoIIN project and highlighting work that we did throughout the year in order to just keep encouraging and sustaining the efforts, and also highlighting a local health department, Public Health Madison-Dane County has done a lot of work over this last year in integrating health equity and breastfeeding. And so we're bringing them as a panel discussion. They did a lot of outreach with community agencies that represented different groups that were experiencing disparity in breastfeeding rates in the Madison-Dane County area, and work extensively with them to find the cause of this, and doing a lot of outreach and working with creating programs and support within the community through these community agencies. So we're excited for them to share their work at our summit and just show that, you know, through Wisconsin, that we are integrating efforts, the local and tribal and community efforts, so that we can have a more consistent approach. And then we also had, our governor did declare August as Wisconsin's Breastfeeding Month, so that was an exciting declaration as well.
Excellent, lots happening. Sean, would you be able to share that mini grant application with the team? So, I mean, that seems like such a nice way to, again,
Sure. Yeah, we used a SurveyMonkey tool, and so what I can do is put the link to our SurveyMonkey, and then if you want to scroll through the questions to see what they are, okay. I think that'd probably be the easiest format.
Okay. And if others are interested, I'll add that in our resource list to send out when I send it out after the meeting.
Okay.
Kenya says yes. Okay. Thank you, Shannon. Marcy, did you want to share from what's happening in Louisiana?
Sure, I'm happy to share. a few things. So I don't know that I was on the last call, but in July, I guess it was, we had our first employer support improvement work group, which went really well. We had a good, I don't even remember if I've covered this already. I think I talked with Sandy about it, but maybe not to all of you. So sorry if it's duplicating things.
No, we haven't heard this.
Okay, good. So we had a good combination of, some obviously public health folks. We had a range of employers, variety of employers. We had also regionally as well, or geographically, so kind of spread throughout the state. Large employers, small employers. We also had a representative from our Louisiana Workforce Commission, which is like our sort of the state Department of Labor entity. And this particular representative actually was a breastfeeding mom herself and really struggled with this. And she was super enthusiastic about participating. And we had some like professional organizations represented as well, like the occupational, someone who's on the board of the Occupational Nurses Association. And then that kind of led to some other things. And anyway, a lot of great ideas were generated. We also had, we had a home, one of our home visitor, I think she's an outreach coordinator. We had a home visiting outreach coordinator present. We had really tried, I think, pretty hard to get a few WIC mothers there, as well as one of our home visiting participants. And it ended up not working out. They weren't able to come, but, a couple of them expressed interest in, trying to make the next meeting or trying to be able to call in. So we're still trying to really work on that piece to really ensure that we have, mothers represented. So it went well. We're planning another meeting for September. We're going to try to do something where people meet up regionally and then call in. So we're trying to kind of figure out logistics around that. And we also, sorry, I feel like I'm kind of rambling, but we, as a result of our first meeting, we were then able to identify an outreach opportunity, again, with the Occupational Health Nurses Association, and we got to share information at their conference. And we gave this particular contact some talking points to be able to share information with their board. So that was really great. And then it's also generated some additional opportunities for us to, speak at different conferences and things like that, like their next conference and stuff. So, it doesn't seem like that should all have, take up that much time workload wise, but it has. So that's what's kind of been front and center for us, the work group stuff.
That's a lot of progress, because convening and getting all the stakeholders, that's the, that takes time. So, wow.
Yeah, I'm trying to make it worth their time. You know what I mean? Like, we don't want to waste people's time. So it just takes planning and really some thought about what we want to do, collectively, and what's reasonable and feasible, and, how we're going to get there. So, we hope to come out of the next meeting with some more concrete goals. The first meeting was a lot of background information, just to kind of, tell everybody about the CoIIN, what we've done, historically with the workplace breastfeeding stuff throughout the state, and that sort of thing. So we're looking forward to future meetings being way of less of us talking and really more of the group. So thanks for letting me share.
Thank you, Marcy. Ifine, what did you want to share some happenings from your state?
Yes, I can give a brief update. Here in California, our CoIIN is focused on increasing lactation accommodations and knowledge around lactation accommodations. And so we've done a great deal of work in regard to surveying the local breastfeeding coalitions and organizations, which are doing the direct services within the different local health jurisdictions throughout California. And so and we've also partnered with the USBC, and we've put on 2 webinars now, one which primarily focused on lactation accommodation laws and policies at the federal and state level, and even highlighted some local governments here in California, such as San Francisco, which have very strong lactation accommodations for employees and employers, hopefully to enforce. And so we partnered with the Legal Aid Society and Family Law Centers here in California for that first webinar. For our second webinar, we partnered with the USBC, and we used the theme social media platforms, and really wanted to engage coalition leaders and encourage them to use different social media platforms to help educate their communities, but also employers in the communities, just knowing how prevalent the usage of social media platforms, whether it's Facebook, Twitter, Instagram, Pinterest. And so that was really well attended and well received. And so we look forward to doing additional collaborations with the USBC as it pertains to highlighting and amplifying our work that we're doing. In addition to the different webinars that we've done, we've also created an infographic, which is specific to educating around lactation accommodation, the laws and the policies, but also including some more recent data as it pertains to who has access to lactation accommodations here in California, and how employers and employees can really work together to improve access and the usage of lactation accommodations. And then lastly, we're currently working on updating our lactation accommodation brief. And the brief is used to educate legislators in regard to different lactation accommodation legislation, which is currently on the floor, but also to keep them engaged in the conversation throughout the year. And so they understand the importance of not only lactation accommodations, but supporting breastfeeding and different laws or legislations that come through that are really highlighting or discussing the importance of breastfeeding, or the expression of human milk, or the use of donor human milk. Right now in California, we have a couple of lactation accommodation laws which are focused on students and university settings. And so we really want to use the brief to amplify the current legislation that is hopefully will be voted on and passed in our state Senate. So that's a brief update of the work going on in California.
Thank you, Ifine. And is the infographic, is it on the ASPHNR website by any chance, Sandy? No, right? Is it anything that's some of the products here that are being made? Because it would be great, even though it's California specific, that design is wonderful, and to be able to kind of customize it for other states would be so helpful. Ifine, is that something you can share?
It is not currently posted on there. I think our preference would be to make a link to it if it's on the California Breastfeeding Coalition website, which it is, isn't it, Ifine?
It is on that website, but it's also on the California Department of Public Health website on the Breastfeeding Initiative page. So I can send those links if a link is easier for folks to use. I can definitely send that. And there's a PDF of it as well, so I can send both of those.
Oh, that would be
Iowa. Iowa created an infographic, was creating an infographic. Is it finished yet?
It's pending final approval, about to go to print. So yes, we bought back and forth with some of the layout and color and that kind of stuff, but it is on the chopping block for getting printed just as shortly.
Wow.
Right,
We're
because you
waiting
use
for
the California as part of your template and background ideas, right?
I believe we looked at it for some of the content and got ideas from it, I believe.
Yeah.
We created our own, but it was
Yes. I think what Stephanie said to me was they looked at California's and CDC's and took what they thought was appropriate for Iowa and then Iowanized it. She used that word, Iowanized.
Exactly.
I like that word.
Definitely.
So when it's done, we could post it as well.
I was just going to
if
speak up
anyone
and say
has
that.
things, yeah.
Yeah. And I will agree with colleague from Iowa that it is definitely a process. Our CoIIN is a collaborative between our California WIC Association, but also colleagues from the California Department of Public Health. And so any products that are made needs to get approval from the Department of Public Health. And so it is definitely a process in regard to making sure everyone's on the same page in regard to content and figures and data and citations and language, making sure we're all on board in regard to using gender neutral language and things of that nature. So, and making sure that it can get translated into different languages. So it was definitely a process, but a process worth going through because the end product, we're really excited and proud of the end product. So.
Yeah, everything takes longer in state government, like we all know.
It does. And the approvals, but that's great. I can't wait to see the Iowa one when it's done. And just as Ifin was said, the USBC staff is here for you. So often when you have your own state team meetings or the other, if you want our support, anyone who's doing workplace, we have a very, very robust workplace support system because our staff team member, Cheryl, is the steward. But we also have all of these, the National Women's Law Center, ACLU, and others who have happily would like to partner with states that are working small or big. They don't really, in any kind of policy with workplace. So make use of us. We can come to your meetings. We could do trainings for you as well. So if there's anything where you can think of USBC to do any support for you between these meetings, we'd be happy to help your state teams as well. I know we are absolutely on to at the end. Is there anyone who hasn't gone yet? I see that we have a slide, I think, somewhere where we say what we are going to do. So, Miriam, do you want to show the page? I'll make you the presenter. We'll take 1 minute and then I can send my resource list. I was going to walk through some of the big ones, but I can email you the resource list. There's a very good National WIC Association is doing a workplace webinar today that Cheryl is presenting on. It's in an hour's time, so you can. I'll send the reg info, or I'll send the link for the recording as well. That's being done by the National WIC Association.
Yeah, and so I just wanted to take a minute to show you guys the National Breastfeeding Month website on USBC. If you go to USBC breastfeeding/MBM, you can click on here, and we have so many resources for you guys. Week 1 was the policy pulse, where we had different resources from the fields, and if you scroll down here, For week 2, we had special circumstances and emergencies with different video recordings and webinars. Just a lot of information. And even though Breastfeeding Month is almost over, these resources will stay on the website for anyone to look through and participate in. Definitely for the call of action. A lot of these policy initiatives are still happening, so feel free to look through this and participate in whatever you can and share as much as you can as well. And this is for the final week. So yeah, feel free to look through this, and if you guys have any questions or if you didn't get the email from us, you can share your email on the chat and we'll make sure that you have an easy access to that as well.
Yeah, we've been sending for every week of this month, we've also been sending resources and actions from the field and things. So again, if I hope you all get the weekly wire, and that's pretty much the e-blast that we've been using for our the National Breastfeeding Month materials. But some of our other USBC updates are in the resource list. So I know I want to be respectful of your time. Any closing thoughts? Anybody has anything to share before we close? Thank you, Miriam, for this.
Sure.
If there is anybody from this group that's working, if it might not be part of your CoIIN, but if your state is working on safe sleep and breastfeeding integrated messages for that, would you please let me know? Because I'm on another HRSA project that's doing safe sleep, and they want to pilot some really good materials with states. So we are looking for folks. I know Sean is part of that, but if there's any other states here that are working on safe sleep, please send an email to me, and we can find synergies with that in our breastfeeding messages as well. So thank you all again. This hour really passes by quickly, and this is the resource list that we had. Miriam will send that with the recording soon.
And this is Sandy. We will be posting the resource list on the Healthy Weight CoIIN part of the ASPHN website as well.
Wonderful. Thank you, Sandy. Thank you, Karen. Thanks, everybody. Our next meeting is going to be last Thursday of October, same time.
And this is Diane. I know I've been typing in the chat. I just want to make sure somebody has seen those things.
Oh, yes. I thank you for that. And Diane, I am seeing your chats now. We'll make sure that we answer all of those. Yep, I'll give you the list of what USBC does. And we are in touch with CDC on their grand rounds as well. So thank you for that. I'll send this info for the rest of the group if any of the other states are doing safe sleep as well. Thanks, everyone.
Thank you.
Bye-bye.
Thank you.